This is Plant-Based Briefing, review of the plant-based nutrition and lifestyle medicine news, August 2025. Part 1 by Shireen Kassam at plantbasedhealthprofessionals.com. And I'm Marian Erickson. This is the curated content plant-based podcast where I narrate articles on plant-based and vegan living with permission in about 10 minutes or less every weekday. And this article is longer than that, so it's a 3-parter. I'll read part 1 today and then tune back in for the next 2 episodes. And now let's get to today's plant-based briefing. Review of the plant-based nutrition and lifestyle medicine news, August 2025, Part 1 by Shireen Kassam at plantbasedhealthprofessionals.com. This month, I cover lifestyle strategies for mental health, interventions to prevent cognitive decline, omega-3 fats, the huge benefits of physical activity, UPFs, and thumbs up to eating potatoes. As evidence continues to grow, the message is becoming clearer. Lifestyle medicine is not an optional extra, but the foundation of good health. Across mental, heart disease, dementia, diabetes, and even mortality itself, the same story repeats. What we eat, how we move, how we sleep, and the environments we live in shape health outcomes more powerfully than medication alone. This month, I highlight some of the most significant new studies reinforcing the role of plant-based nutrition and lifestyle approaches as first-line strategies for prevention and treatment. Lifestyle medicine in mental health care. People living with mental illness face profound health inequalities, dying 13 to 15 years earlier on average than the general population. Most of this gap is not due to suicide, but to preventable physical diseases such as heart disease, diabetes, and cancer, conditions strongly shaped by diet, physical activity, sleep, and smoking. The Lancet Psychiatry Commission's 2025 report makes a compelling case for embedding lifestyle interventions into mental health care as a core clinical practice rather than optional extras. Diet quality is consistently lower in people with mental illness, and nutrition-focused programs, particularly those based on a Mediterranean-style eating pattern, rich in whole plant foods, have been shown to improve both mental health symptoms and physical outcomes. In some trials, these dietary changes even reduced overall health service costs, highlighting that food can be both therapeutic and economical. Exercise, too, emerges as a powerful form of medicine. Structured programs improve mood, support recovery, and lower cardiometabolic risk while building quality of life and resilience. Better sleep hygiene plays an equally important role, and smoking cessation remains one of the most effective and cost-saving interventions available. Importantly, the report emphasizes that multi-component programs that bring these elements together are the most effective of all. Yet lifestyle medicine remains poorly integrated into routine psychiatric care. The barriers are familiar: under-resourced services, lack of specialist training for clinicians, persistent stigma, and our default reliance on medication alone. The Commission calls for a paradigm shift, one that involves employing dietitians and exercise professionals within mental health teams, supporting peer-led initiatives, tailoring programs to cultural and personal needs, and addressing the wider determinants of health such as poverty, housing, and food insecurity. This is more than a matter of physical health. It is about reimagining mental health care as holistic, humane, and preventive. The evidence is clear. Food, movement, sleep, and social connection are not nice add-ons, but evidence-based therapies that can transform outcomes when given the priority they deserve. Lifestyle first in preventing and treating high blood pressure. High blood pressure remains the most common preventable risk factor for heart disease, stroke, dementia, kidney disease, and premature death. The 2025 American Heart Association and American College of Cardiology guideline underlines what we already know but too often fail to act upon. Diet and lifestyle must be the first-line treatment for raised blood pressure. The evidence is unequivocal. Weight gain, poor diet quality, lack of physical activity, disrupted sleep, alcohol use, and stress are the drivers of hypertension across the lifespan. Conversely, a shift toward healthier behaviors can both prevent blood pressure from rising and bring it down once elevated. A diet based on whole plant foods rich in fruits, vegetables, whole grains, beans, nuts, and seeds naturally lowers sodium intake while providing abundant potassium, fiber, magnesium, and plant protein, all of which help reduce blood pressure. The DASH, or Dietary Approaches to Stop Hypertension diet, itself rich in plant foods, remains the most effective eating pattern studied, but Mediterranean and vegetarian diets also consistently improve outcomes. Don't forget that the DASH diet was modeled on the blood pressure lowering effects of the vegetarian diet, but researchers added animal-sourced foods to make it more acceptable. Lifestyle is powerful medicine. On average, dietary change can reduce systolic blood pressure by 5 to 8 points, while regular physical activity contributes similar reductions. Weight loss, even as little as 5% of body weight, can lower blood pressure further. Salt reduction, particularly when combined with a potassium-rich diet, has profound effects, with trials showing meaningful drops in blood pressure and even fewer strokes and heart events at the population level. Stress reduction practices such as meditation and yoga add additional benefit. Together, these approaches rival or exceed the effect of a single antihypertensive drug, but without side effects and with wide-ranging benefits for overall health. Despite this, medication continues to dominate hypertension management, often prescribed before people are given the tools and support to make meaningful lifestyle changes. The new guideline recognizes that in lower-risk adults, medication should only be considered after a 3 to 6 month trial of lifestyle modification if blood pressure remains elevated. This reflects a crucial shift, acknowledging that lifestyle is not a soft option but an evidence-based therapy that should form the cornerstone of care. The challenge is implementation. Achieving healthier lifestyles requires more than just individual willpower. It demands supportive environments, affordable access to healthy food, opportunities for movement, and culturally tailored interventions. Clinicians have a central role in advocating for these changes, but policy, community, and public health action are equally vital. Preventing cognitive decline with lifestyle. The search for effective ways to slow or prevent dementia has often focused on drugs, yet lifestyle medicine is proving to be just as important, if not more so. The U.S. Pointer trial, just published in JAMA, provides some of the strongest evidence yet that multi-domain lifestyle interventions can protect brain health in later life. This large, multi-center, randomized clinical trial enrolled more than 2,100 adults aged 60 to 79 at elevated risk of cognitive decline due to sedentary lifestyles, suboptimal diets, cardiometabolic risk, or family history. Participants were assigned to either a structured, high-support program or a lower-intensity, self-guided program. Both emphasized the same principles: a healthier diet modeled on the MIND diet, rich in plant foods with proven brain benefits, regular physical activity, cognitive and social engagement, and cardiovascular risk monitoring. After 2 years, cognition improved in both groups, but gains were greater in the structured intervention, where regular meetings, coaching, and accountability helped people stay on track. The structured group showed significantly better improvements in global cognition, particularly in executive function, compared to the self-guided group. Importantly, the benefits were consistent across key subgroups, including those at genetic risk of Alzheimer's disease. This study is unique in its scale, diversity, and length of follow-up, and it reinforces the lesson from the landmark Finnish finger study, targeting multiple risk factors through diet, movement, social connection, and vascular health can slow cognitive decline. Unlike pharmaceuticals that act on a single pathway, lifestyle interventions address the full spectrum of risks, offering safe, affordable, and broadly effective protection for brain health. You just listened to Review of the Plant-Based Nutrition and Lifestyle Medicine News of August 2025, Part 1 by Dr. Shireen Kassam at PlantBasedHealthProfessionals.com. I'm your host, Marian Erickson. Tune in tomorrow and the next day for the next 2 parts of this episode, where you'll hear about plant-based diets and mental health and neurocognitive outcomes, ultra-processed versus minimally processed foods, potatoes and diabetes, omega-3 fats, and physical activity across life. So please share this episode with anyone who might benefit, and thanks for listening.